Get started. Hello and welcome to Attendance webinar. Today we're going to be presenting ICD-10 Down to the Wire. This is the 10th installment of our educational webinar series, and we hope that you find it helpful and insightful. My name is Chelsea Lukens, and I'm the Marketing Communications Coordinator for Attentive. I would like to take a moment to explain the process for today's presentation. First, I would like to mention this webinar will be recorded. Next, I'm pleased to announce our upcoming webinars. Next will be a preview of the CMS Proposed Meaningful Use Relaxation Rule on July 22nd. Then on August 12th, we will be presenting Improving Patient Satisfaction with the Portal. We hope to see you at them, but if you can't make it, we will offer recordings of the webinar on our website. Moving on to ICD-10, Down to the Wire. At the end of the presentation, we will open the floor up to questions from you. We will answer all of the questions at the end, but you may type them in the questions area of the webinar control panel whenever they occur to you. If we're able to answer them mid-presentation, we will. Finally, for audio clarity purposes, everyone's phone will remain muted throughout the entire webinar. If you experience audio issues, please use the chat box to let us know so we can resolve them. And again, questions may be entered in the questions box. So without further delay, I'd like to introduce our presenters for today, Jeannie Logue, Marie Shin, and Sean Harvey. Jeannie Logue will be leading the presentation. She has been in the industry for over 25 years and is Director of Management Consulting at Attentive and is one of our leading experts. You've likely heard her speak before, either on previous webinars or in person at UGMs and MGMAs. She has worked here for 3 years and lives and breathes the industry and travels across the country seemingly nonstop, working with our clients at their locations. Marie Shin originally joined us from the Ohio State Intern Program, where she was getting her degree in Health Information Management Systems. After graduation, Marie joined our team as the NextGen Optimizations Coordinator, where she has been fully ICD-10 focused, making sure clients have all the necessary resources to smoothly make the transition to ICD-10. Finally, Sean Harvey will be able to jump in with additional information and answer your questions. He's been with Attentive for a year and a half. He also originally joined as an intern while he completed his degree in Health Information Management Systems at The Ohio State University. Since then, he really has become a true NextGen expert and has fully immersed himself in the ICD-10 changes. Jeannie, I'm going to go ahead and pass the webinar off to you. Feel free to get started when you're ready.
And welcome. A few months ago, we did a webinar on the ICD-10, It's Back. And during that webinar, we actually went through the difference between ICD-9 and ICD-10 and why we have to move to ICD-10. Today's webinar is going to focus primarily on NextGen and how do we bring some clarity to all the steps and the terms to get your system ready for ICD-10. So I'm going to actually start the webinar off with a few questions that just keep bouncing around out there and everybody keeps asking, and hopefully just bring some clarity, and then we'll get into more detail on how we use these and what we're doing with them. So the first one is, are you ready? And what does the general equivalency mapping, the GEM, do? When do I run it? We hear constantly GEM this, so when do we run it? Why do we do it? What does the clinical data loader, the CDL, you'll hear that term all the time as well, the CDL, you must run it. So when do we run it? Why do we run it? What does the hotfixes do? Do I need to have them? Am I going to build and test, or am I going to build and prod? And do I enable the Intercept tool? And what does it do? So these may be some of the questions that you're asking yourself or you're coming across trying to determine or clarify exactly what we're doing with these. So ICD-10, we've got you covered. So the initial questions and answers that we just went through was the GEM mapping tool, and what does it do? The GEM mapping is going to map your ICD-10 codes to your ICD-9 codes. So once we install them into the system, it's going to help map them to allow the one-to-one maps. So when you enter the charges or enter the information in the KBM, it's going to go ahead and do the one-to-one map for you, or the one-to-many. It needs to be run after you load both your ICD-9 and your ICD-10 files. And you must run this also after you apply the hotfix. So choose the option to create new mappings after you have applied the hotfix. So basically what it is, when you're going into your test environment now, you want to make sure you run the GEM mapping, do some of your testing, but once you load that hotfix, you're going to run the GEM mapping again, and at that point you're going to say create new mappings because you don't want it to undo the mappings that it's already done. Do I enable the Intercept tool, and what does it do? Yes, you will need to enable the Intercept tool. This is going to be part of the Kbm Transition Toolkit, and it will just have a button on it that states enable this feature. Now that is not out until a 7.15, and it's going to be in the transition toolkit. So until we actually have that in place, you cannot enable it until you upload the KBM transition toolkit. The Intercept tool is actually out there to go ahead and capture any ICD-9 codes before they go into EPM. So what it's going to do in the KBM, it's going to pop up and capture any ICD-9 codes and then allow you to intercept them and then change them to an ICD-10 code. What does the hotfix do, and do I need it? Yes, everyone is going to need a hotfix, whether you're on version 5.8, 5.8 UD1, or 5.8 UD2. You will need to take a hotfix. It is also cumulative. All previous hotfixes are included, so plan to test thoroughly. There is no just ICD-10 hotfix, and we'll talk a little bit more about that. Build-in test or build-in prod. NextGen has put out a checklist, and the checklist they currently have out, if you're walking through that, has you kind of building in prod, and they're going to bring out a checklist if you want to build in test. So there has been some confusion on where do I build. And do I copy prod over to test? So if you're going to load your ICD-10 in prod and you're going to start building in prod, then you're going to need to copy prod over to test with all that new build and then do your testing from there. Or you can start building in test and then you can import those into prod. So a little confusion with this one, and it doesn't, there is no wrong way to do this. It just depends on whether you want to build in test or build in prod. Now there is one area that we'll talk about with diagnosis categories that you're going to have to build those in prod. What does the clinical data loader do, or the CDL? When do we run it? The clinical data loader is going to affect your HCC coding, your search results, your clinical problems, your SNOMED to ICD mapping, and your ICD-9 to ICD-10 mapping. The CDL usually runs on all your database servers. Now we have found that a lot of clients don't have the CDL running on their test databases or the Devel databases. So when you actually load the ICD-10 codes into your test database, if you're not seeing those in your KBM and you're not seeing them in your search results, it's because the CDL needs to run. So we want to make sure that your CDL is run prior to your application upgrade, and then it's recommended that this is ran on your prod environment monthly thereafter. A new release of the CDL came out today, and you can download that from NextGen as well. So these are just a couple of questions, and then we'll get into some more detail, but these are questions that we're seeing out there that seem to have a little bit of confusion around them. So on the agenda today, we're actually going to talk about pre-implementation, the ICD-9 ICD-10 comparison utility tool, the test environment implementation, a couple of implementation tips, testing in the EHR and in the PM side, the hotfixes and what they do, a little bit looking ahead further down the road, CMS test results on the testing that has been completed so far, and the clearinghouses and the payer readiness. The ICD countdown there is directly from the CMS website, and they are counting down, so we are less than 84 days from ICD-10 implementation go live. So I do not feel that this is going to be pushed back. I do not feel there's going to be a delay. CMS is ready, and we are hitting the ground running with this one. So pre-implementation, the first thing is you need to verify your practice has to be on 5.8 in NextGen Kbm 8.3. There are hotfixes for both of these versions, but you have to be on 5.8 and Kbm 8.3. So during the implementation process, you need to ensure that you have access to the NextGen root components folder. And again, what we're finding is on some of the test databases or Devel databases, we're loading ICD-10 into them, we're not finding the components folder. It's on the prod database, or so your TS department may need to get involved and help you find your components folder. If you're hosted by a third party or if you have connectivity via Citrix, you may be limited to your access to that NextGen root folder. So if you're out looking for this and trying to load your ICD-10 codes, you may already be kind of a step behind by not having access to the correct folders that gives you all the information and all the data that you need to upload. Sharing the NextGen root folder across network drives will ensure that it's an easy access for you. So you want to make sure that your TS department goes ahead and sets these up so you have this folder in all of your databases. Inside the NextGen root folder is going to be the Update Utility tool, and it's actually called NextGen Shared ICD CPT Update Utility. So if you're trying to look for ICD-10 Update Utility, that's the actual name of it, NextGen Shared ICD. It's also going to have your ICD-9 and your ICD-10 GEM, your text files. It's going to have your 2015 ICD-9 codes, and it's going to have your 2015 ICD-10 codes. For your test environments, you want to make sure that you're uploading the most recent ICD-10 file that's available so that you're testing with the most recent data. And you must have Microsoft Excel to import the ICD-9 code file. At this time, there is absolutely no workaround for clients who don't have access to Excel, and NextGen does state in their white papers for this, you need to have Excel to be able to upload the ICD-9 codes. Another part of the pre-implementation process is making sure that your ICD-9 code is decimalized. So if you have ICD-9 codes that are not decimalized, you want to make sure that you do get them decimalized. That is one reason why we are recommending that you reinstall the ICD-9 library to help accomplish this step. If you haven't uploaded ICD-9 codes on a yearly basis as this came out, you also want to make sure that you install your ICD-9 2015 codes so that you have the most up-to-date file, and that is going to ensure that your GEM mapping is going to work properly. You're going to run your clinical data loader prior to upgrading to your version 5.8. So if that was done, that's great. If not, it is recommended that the CDL is run on a monthly basis. We talked a little bit about the HCC codes and snowbin mappings between the problems and the ICD codes. Now, the most recent version of the CDL updated is February, but that, again, a new one came out today, so we didn't get this slide updated. So you're going to go ahead and look for the one that came out today because it is the most up-to-date version of the CDL. And you're going to definitely make sure that you perform a refresh of your database in your test environment if you have not done one in the past 30 days. So this is where we're saying copy prod over to test. And again, you want to try to keep those environments as close to as refreshed and close to matching so that when you're doing your testing, you're currently using current data. The ICD-9 and the ICD-10 comparison utility, I'm curious if anybody has really jumped on and used this. It's actually a great utility that NextGen came out with that's given you a little bit of insight to how are my codes going to how many codes am I going to go from 9 to 10? So the comparison utility is a web-based educational testing tool. It gives you the familiarity with the code mapping. So it's going to tell you if I pull my top 20 or 50 codes, am I doing 1-to-1 mapping? Am I doing 1-to-5 mapping? It's going to give you that variance of how many new codes am I looking at. You can actually upload an 837 file, and it will convert the 837 file for you and show you your 1-to-1 mapping, and then have you choose, okay, here are all the codes that needed a different ICD-10 code because there's many to choose from, and which one do you want to choose. So if you have not uploaded an 837 file to this utility, I suggest that you do. It does help providers become efficient in their understanding of the codes. You can export this once you've uploaded your 50 codes, and you can kind of give it to your providers and say, you know, here's the code that you've used the most in the past year, and here's the 5 codes that you're going to choose from this year as of October 1st, and help get them familiar with what are the codes that they're going to be seeing and using come October 1st. It definitely helps your coders to better understand those new codes, and then they can dig a little bit deeper of understanding of the ICD-10 codes rather than looking at all, you know, thousands and thousands out there. They're going to look at the codes that pertain to your practice. It'll help you understand and compare reimbursement differences between the 2 code sets as well. So if you've not signed up to use the comparison utility, I would suggest you go ahead and, you know, get started with that and play around a little bit with it. You do have to have access to the NextGen Healthcare Client Portal. You'll receive an initial administrator for access to the utility, and then once you do that, that administrator has the ability to go ahead and give other users in your practice access to it. Upload the 835 for testing, and then review individual codes if you choose to just punch in an individual code. So what I've shown on the screen here is just a couple of views from that. So if we punch in the 599 urinary tract infection, it pops up the ICD-10 code is going to be N39. but that is specified not. That's a site not specified. So there are additional codes that could go along with that one as well. And then what I did on the bottom was I pulled out, my top 20 codes from an environment or a database, and I went ahead and loaded them up, and it brought back results for me that says, okay, code 7860, I have the choice between R50.2 and R50.9. And it's going to give you a little bit of understanding of my 49390 asthma code can be broken out into a couple of different ICD-10 codes. So this is a great way to really just look at the codes you specifically are using on a regular basis and what the new code is going to be for ICD-10. In the test environment implementation, step 1, and again, NextGen does have out there a kind of a checklist that goes through the different steps, but the first thing you want to do is import those ICD-9 codes with an expiration date of 9/30/2015. Now, we're going to go ahead and overwrite the current coding descriptions and data parameters with this new data. That is a choice, okay? If you have a lot of coding descriptions in there that you've customized your ICD-9 descriptions, you may not want to override those descriptions. But again, you're doing this in your test environment, not your prod. Then we're going to go ahead and import our ICD-10 codes with an effective date of today. Making the codes effective today is going to allow us for current testing in the environment. There's been a lot of other questions on, well, why do I want both of them available in my test environment right now? We don't want them to overlap. That's correct. But right now in the test environment, we're saying take a look at both codes together. Look at your 9 and your 10. Have the ability to choose both 9s and 10s and understand it. And once you're going to import these codes into prod, once all the documentation and hotfixes have been released, your effective dates of the two codes are going to be mutually exclusive. You will expire out the ICD-9 on 9/30, and your 10 codes won't start till 10/1. But there's no problem right now in your test environment having both of the codes available just for testing and understanding and seeing the differences between the two different codes. Once you've got your 9s and your 10s loaded, you're going to go ahead and load them by using the NextGen ICD-10 or ICD-CPT for update utility. When you go ahead and pull this utility up, it's going to go ahead and let you load the 9 first, and then it's going to let you go ahead and do this process the second time and load your 10s. Now, I talked about that update existing code description. If you do check that box, it will change your current ICD-9 descriptions. If you've not customized those, it's not going to affect anything. And this is, again, where when you're trying to do the ellipsis and open up your ICD-9, you will need to have Excel to be able to open up the ICD-9 file. Once we've brought both of those into our master file, if there is multiple libraries exist, we're going to have to ensure that we do this for each one. So if you have multiple ICD-9 files right now, you're going to have to do the ICD-10 and the ICD-9 for all of your existing libraries. Importing the ICD-9 codes with utility will automatically populate the diagnosis library, ensures that the codes are accurate. Again, if multiple libraries exist, ensure that this is done for each one of them. And what we're going to do here is you're going to actually, once you've got them into the master list, we now need to bring them into the library. So there's been a little bit of confusion on we use the utility, we bring them in, but they're not showing up in the library. There is a step for you to actually bring those codes into your actual library. Now the 9 codes, once you load them, are already going to go into your existing library, and you need to bring the ICD-10 codes into the library. And that is just done by opening up Add Codes from ICD Master File. You pick your 10 codes, and this is where you import your codes with an effective date of today. Now the gem mapping utility, again, we talked a little bit about what does it do. Once you run the gem mapping utility, after you've loaded your 9 and your 10, you've updated your libraries, then you're going to run the gem map utility. What this is going to do is actually link your 10s to your 9s for any one-to-one matching. And this is going to be for your general, which is going to help you when you do your billing. So I showed a couple examples of my E0821 maps to 249.40, and it maps to 581.81 of my ICD-9s. And then my E08341 is actually mapped to 3 different ICD-9s. So when you look at this, you're going to see some of the mapping. Now, there are going to be a lot of codes that do not map. So after you do this process, if you're scrolling down trying to see what's mapped, you may find a lot that are not mapped. The best way to take a look at what did map is go ahead and print this, or at least go ahead and print it and pop it up on your screen and take a look at the different ICD-10 codes that have mapped back to 9. This will give you another visual of how many codes you're currently using, how many of them actually map to other ones, and get you familiar with the ICD-10 codes. Once we've completed the GEM mapping step, the last piece we want to do is go ahead and run the clinical data loader utility. These are going to go ahead and give you your effective dates that are entered into the test environment. If you currently loaded your ICD-10 codes and you're not seeing them in EHR, the clinical data loader piece is what's missing. So if you've gone ahead and you've done it and you waited overnight and your CDL is not running currently overnight, then you need to have somebody go in on your TS and make sure that they run the clinical data loader for those codes to pop up in your EHR system. Otherwise, when you do your diagnosis search in EHR, you're still going to only pull up ICD-9 codes. The update that is slated to be released mid-July will include some of the import for ICD-10 requirements, and that is the one that was actually released today. You're going to want to make sure you set up your ICD-9 codes for your non-covered HIPAA entities in the payer master file. So under the defaults 2, you're going to select Send Diagnosis Mapping on Claims. Now this is for all your payers that are not going to accept ICD-10 codes. And these are your workers' comps or your motor vehicles. Now I do highly suggest that you call your worker comps, all of them, local. Get somebody on the phone to call them, because we are finding that a lot of the worker comps are going to go ahead and take the ICD-10 codes. That will save you from having to set this up for every one of those payers. So just make sure that when you go to set these up, you've already identified which payers require ICD-9 codes after October 1st and which ones are going to go ahead and just accept ICD-10, and you won't have to do this additional setup. Enabling, there's a new claim edit out there, 279. This edit is enabled for the payers who will only accept ICD-10s. So it's all the HIPAA-covered entities. So you want to make sure that you turn that claim edit on as well when you're doing your testing. An ICD-10 implementation tip, and we talked a little bit about having ICD-9 and ICD-10 codes in our test environment, both active at the same time. There is a way to go ahead and change those effective and expiration date parameters. So if you've looked at your 9s and your 10s and you're good with all that, and you want to go ahead and change this expiration date, and you want your test environment to look exactly like your prod's going to look on October 1st, the dates are set up using that CPT import utility for ICD-10 codes, and then the dates in the file and should be overwritten to ensure that ICD-9 or ICD-10 codes are not enabled in prod until October 1st, 2015. And there's a quick screenshot of going how to do that. So you can alter these dates. If you're bringing them into test now to look at them both, you can go ahead and update those dates at any time. So you just want to go ahead into the ICD master file, select the Norton New button, select your update effective expiration dates, and then just fill in the parameters according to, if you want ICD-10 or ICD-9, and then you just update the effective dates and the expiration dates. And this is definitely how you're going to go ahead and run them exclusively in the prod environment. So if you've got your test with both of them available right now, you can go ahead and do this to set up your test to look exactly like prod. System admin, another implementation tip. System admin, it is always recommended with any large upgrade that system admin be reviewed closely. There is some new rights that are associated with ICD-10, and which users have the ability to add any kind of SNOMED cinnamon. So you want to go ahead and make sure that you go in and look at these. Who do you want to give the rights to? Test, test, test. We can't stress enough that if you follow the steps on the slides, it's going to get your environment set up to allow you to start really testing and looking at how ICD-10 is going to function within your environment. It's going to allow you to determine what needs to be changed, what needs to be fixed. Once the hot fixes come out, you want to go ahead and load the hot fixes and then test again. You want to make sure you're testing both EHR and not PM applications. You need to make sure you're doing both. I know there's a lot of focus on PM and billing, but we want to make sure that people are testing the EHR system as well. So in the NextGen EHR testing, some of the recommendations that we're doing is go ahead and look at both ICD-9 and ICD-10 encounters right now for comparing the differences. That's the reason for not expiring your 9 out immediately when you load them. Take a look at them together, compare the differences in the workflow. The main diagnostic coding workflow, add an update and assessment. Look at your common assessments. When you load 10, it's going to give you the opportunity to, the 10s are already in your common assessments, so you can pop back and forth, look at your 9, look at your 10 for each of those. The My Plans, determine how your My Plans are working with your 9 codes, and then test them with your 10 codes. Are they working? The Plan Details template, Assessment Plan Details, again, do the same thing. Look at them very closely with ICD-9 codes and ICD-10 codes, chronic conditions, and your finalized templates. Templates that includes orders and templates that includes procedures. Go ahead and make sure that they are actually pulling the right ICD-10 code if there was a hard-coded 9 in there before, or is it pulling both if you have both of them available. A couple of other things that you definitely want to test in your EHR testing is any changes made on your care guidelines template. If you've made changes, make sure that they are working properly with ICD-10. Stored diagnoses and in your quick saves and your quick notes. These are all things that you need to have somebody clinically running through these. Templates that utilize procedures with default diagnosis, whether they're custom templates or the Kbm templates that have a default diagnosis. If they're the Kbm ones that came out of the box, once you do the hot fix for the Kbm, which will be out in mid-July, those should automatically flip to the 10 codes for you. If they're customized, you're going to have somebody take a look at those and they're going to have to make some changes on it. Your office diagnostic templates, your specialty specific templates, biopsy logs. These are all things that need to be touched by somebody on the clinical side to make sure that they are functioning the way you need them to function on October 1st. So the NextGen out-of-the-box templates, the modules, common assessments, procedures, office diagnostics are work based off the ICD code effective date. So if we go ahead and expire our 9s out in our test environment today and only have 10 available, those will all function with an ICD-10 code attached to them. Coding libraries contain that mutually exclusive effective date and expiration date, so these templates should populate the correct codes. Now, any custom templates, you will need to review them. You will need to test them. So in your standing orders, if you created some special standing orders that are linked to diagnosis codes, those will need to be touched. Somebody will need to either redevelop them or make sure that they're pulling the correct codes for you. On the NextGen PM side, I think a lot of people have already started this testing, but charge posting, make sure that you have some ICD-9 and ICD-10 encounters. Again, look at the difference between the two. Claim creation, go into your claim edit library. Run your claims just like you would do through your normal billing cycle. Is it throwing any edits that it should or shouldn't be? Create an EDI file. Send your test claims to your clearinghouse. If you've not contacted your clearinghouse, you need to get a hold of them this week, and you need to start sending test claims to them. Confirm your ability to send any parameters that need to be met, and test with payers that are accepting the test claims as well, too. Your clearinghouse is going to let you know which payers are actually accepting test claims. So post-test, so we've set up the test environment. We've ran some training and testing through that. So now what do? Configure any necessary changes in your test environment based on your testing results. If you're finding that the ICD-9 codes or the ICD-10 codes are not actually populating correctly and the 9s were, reconfigure and test again. You will need to understand not only how to choose the correct code, most importantly is how to document and change the documentation to support the code chosen. We've always had to code correctly for CPT codes. The documentations had to meet our CPT code, and now it's the same for the diagnosis. There's a lot of right and lefts out there. Depending on your specialty, documenting correctly to choose the correct diagnosis code is going to be very important now. So you want to look at your documentation on which codes are you using, and is your documentation supporting the new ICD-10 code that you have chosen. And then, of course, training, and more training. The only way you're going to determine, which direction to do your training and where you need to focus is by testing and determining exactly where, the gaps are, and then retraining to make sure that you close those gaps before October 1st. We talked a little bit about the hot fixes. Every version is going to have a hot fix. It is required that you take the hot fix to be ICD-10 compliant, to have all the pieces that you need to make ICD-10 work on October 1st. 581, Hotfix 140 was released, and Hotfix 141 just came out today. So there's even a new release as of today of a new hotfix. 140 does have all the components that are needed for ICD-10. 58UD2 Hotfix 16 was also released. So if you're on either one of those versions, I suggest you go ahead and get that hotfix in your test environment and start testing it with ICD-10. The 8.3 through the 8.3.10 is due to come out in July 15th, and we'll talk a little bit about what's involved in that one. And then 5.8.0, if you're on that version, the hotfix is not due out until the 1st of August. That doesn't mean that you can't start your testing now. It just means there may be some issues, there may be some things that aren't working correctly that will work once that hotfix is put into place, but you still want to go ahead and do your testing now. Provider mobile, if you're on 2.4 or 2.5, that hotfix has already been released. And if you're on 2.3.5, that one will be released in August as well. Dashboard Duty 1 has already been released, and Population Health has already been released. So the hotfixes are being released out there, and you want to make sure that you pull them down and get them in your test environment. Now, the other thing I did mention early on is these release notes for the hotfixes. You do need to read the release notes, because if you're on hotfix 87 or 88 right now, you're going to go up to hotfix 140. It is going to go ahead and encompass all of the previous hotfixes. It is cumulative. So the hotfixes are an integral piece of the ICD-10 implementation. They must be applied. An ambulatory application earlier than 5.8 will not be ready for ICD-10, and an ambulatory KBM earlier than 8.3 will not be ready for ICD-10. And the hotfixes are available on the NextGen Healthcare website under the client resources, and you can go ahead and download those. So in the Kbm Icd-10 hotfix, there's a lot of questions about what is this going to do, why do I have to take it? A couple of the solutions that it is going to fix is any hard-coded ICD-9 codes. Those are the ones we talked about if they're on the office diagnostics, if they're on the different procedure codes. It's going to flip to the ICD-10 code, so it will correct those. It's going to fix some ICD-10 defects that we've already seen and determined, so the hotfixes are going to fix some of those problems. And then your order sets, it's also going to resolve the problems with the order sets. So application enhancements is the standalone tools, and that's the mobile and your dashboard. Enhancement for future orders, and it's going to hide all the ICD-9s and the provider favorites. It also includes important medical necessity updates, if anybody is using medical necessity. A couple of other application enhancements is the dual coding pop-up. What the dual coding pop-up is going to do, we're going to look at that in a moment. In the immunization SQL script, this is going to go ahead and run through and change all your ICD-9 codes to the ICD-10 for all your immunizations. There's an optic update in there as well, your EHR report writer, and then an Intercept utility. You must enable each of these enhancements once the hotfix has been applied, except for the ICD-9 Intercept utility enhancement. That is going to be an automatic function. And what that's going to do is allow that if you choose a 9 code, it's going to pop up and give you the different 10 codes that you can use. The ICD Intercept tool is going to catch your ICD-9 codes that have a one-to-many match, and then it's going to prompt the user to choose the appropriate ICD-10 code. So this is going to be on the KBM side in the EHR, and it's going to pop up, again, a box that says, we have a one-to-many match. Which ICD-10 code do you want to choose? The tool will function when an ICD-9, I just said that, apologize. If the code has a one-to-one match, the workflow will proceed and you won't see any of this. It will be no interruption. You can change the date of the Intercept tool. The tool is designed to prevent any hard-coded ICD-9 codes and NextGen EHR templates from being sent through to the charge crossover to NextGen PM after 10/1/2015. Changing the effective date in the test environment will allow users to simulate this charge process. So again, if you're going to test this, you're going to want to make sure that you expire out your 9 to give yourself a true testing of ICD-10 as if it was October 1st. Changing the date of the Intercept tool will require SQL. More information regarding the tool will be available in the Kbm Hotfix mid-July when it comes out. So we are unable to test this right now until it comes out in mid-July, and we have the Kbm Hotfix. We'll have a little more data on exactly how this functions and how you want to set it up. So looking ahead, we've already went through how we're going to set it up in our test environment, starting our testing. So once we get all that, comfortable with that, what's our next steps? The NextGen KBM Common Diagnosis Framework review any customized work and add your ICD-10 equivalents to prior ICD-9 editions. These are all an area that you need to have somebody start looking at. Your Common Diagnosis Framework, your impression plans, your guidelines, cardiology assessment plan, DERM. The KBM upgrade is going to, or the hotfix is going to affect some of these areas. So again, we're kind of looking at this, waiting for that hotfix to see how it's going to affect these areas. But you want to start looking at them now, looking for ICD-9 codes that are inclusive in here and whether you're going to need an ICD-10 code to swap it out. Evaluate your contracts. This is another thing that I think we want to make sure that you've got your eye on as well, is evaluating your contracts with your payers. Be really thorough when you're examining new contracts. Watch for payment adjustments for a broader range of diagnosis codes. Contracts which include pay for performance based on ICD-9 need to be modified for your ICD-10. So if you've got contracts right now on pay for performance with ICD-9 codes, someone needs to be pulling those out and taking a look at them, get a hold of your payer and start talking about modifying those for the ICD-10 before October 1st. The diagnosis categories, we have seen when we pull in the ICD-10 codes and the diagnosis categories, if you go ahead and leave 9 available and 10 available, you're going to see 9 and 10 both available in your diagnosis categories. If you have custom created any diagnosis categories, you're only going to see the 9 codes, and you're going to have to go in and manually pull over the 10 codes you want in that category. So if you're currently using a lot of diagnosis categories, you'll want to take a look at those. That is something then again you're going to want to build and prod and not have to build and test, because that's going to be in the file maintenance. You're going to be building those categories again. But if you go ahead and pull in your 10, look at the custom or the non-custom diagnosis categories out of the box, they're fine. They're pulling in 9 and 10 codes, and you won't have to make any changes with that. The data maintenance, make sure that you have your HealthWise patient educations updated. You can do that currently now. Go ahead and pull this down, and I've given you both links to the Catholic and the multiple language for those. So if you haven't thought about your education forms, go ahead and take a look and pull those down as well right now. CMS end-to-end testing. Okay, the second round of CMS ICD-10 end-to-end testing was a success. Over 20,000 of the 23,000 test claims were received and accepted. It was an 88% success rate. That number was up 7% from the first round of testing in January. So it looks like things are going well, and CMS is ready. 2% of the claims rejected were a result of ICD-10 related errors. 1% were a result of invalid ICD-9 codes. 9% occurred as a result of errors unrelated to ICD coding at all. So, I mean, we're not seeing a lot of claims being denied for ICD-10 codes. And there is one final round of end-to-end testing, which is slated to occur sometime mid-July to the end of July. So it's a very positive that we're seeing here as far as the testing. A little bit from the clearinghouse perspective, we've talked to a couple of the clearinghouses. They are anticipating an increase in denials during the initial phase of implementation. That's expected. It was with 5010, and it's expected again. Basically, their recommendation is, and staff training should include, look at your pre-cert request tracking resources. If you had to pre-cert based on ICD-9 codes, you really need to make sure you're pre-certing with ICD-10 codes. Access your payer updates. Constantly watch your payers. What are they updating? What are they changing? Make sure somebody's on top of that in your office. Escalate your ICD-10 delays and issues. Pre-cert appeal letters, no payer response, poor payer response. Look at your appeal letters that you're currently using. Make sure that they're up to date and that you're ready to get those sent out on October 1st if you feel, or actually October 30th if you feel that you're not getting paid and you should be. And monitor your claims very closely for this first several months. Payer readiness. We've been out looking at the different payers and talking to them, and I'm not going to run through or read through each one of these slides. I want to leave some time for questions, but Anthem is stating they're ready. They're ready to receive them. Aetna is also, they're ready. Molina is currently testing with the clearinghouses as well, and they're stating that they strive to make the transition as seamless as possible. United Healthcare as well is stating they're ready and going to make it as seamless as possible. Humana, again, so we went out and talked to and reached out to a couple of the high payers, Cigna. And then workers' comp. Some of the workers' comps, contact your lower ones. They're going to go ahead and accept ICD-10 codes. Make sure that you're not setting out payers for ICD-9 codes that are willing to accept the new ICD-10 codes. So reach out to them as well. If you have any questions with your payers, check their websites, call them. Right now we feel that they are going to be ready. A couple of additional resources that I've listed here. The June ICD-10 end-to-end testing that was about 90% acceptance rates. There's an article about that if you want to read how the testing was done and how all the results were. There's a link to that. Cms Road to 10. This is CMS's website that basically they're doing a countdown and they're keeping things up to date as well for the Road to 10. The NextGen Knowledge Exchange, if you're not on the Knowledge Exchange on a regular basis, I recommend that somebody in your practice gets on the Knowledge Exchange, goes out to the ICD-10 tab, and NextGen is updating things on a daily basis out there. And then the comparison utility we talked early on in the webinar, that is the link to get you signed up for that comparison utility and make sure that you can go ahead and run an 837 file through that and take a look at your results. And when it's all said and done, your providers will be asking, I hear there's a new ICD-10 code for carpal tunnel syndrome caused by clicking too many times in our EMR system. Unfortunately, that's probably true, and we're probably going to have to determine whether it's right hand, left hand, and at what phase the carpal tunnel syndrome is. Is it new? Has it been there for 2 years? So documenting exactly where they're at, how far along the disease is, what side of the body is going to be key as well. Questions? We're going to go ahead and open it up. Chelsea's been taking questions. I thank you for listening to this presentation. There will be more to come as far as we move through the next phase of ICD-10 and testing. We'll be hopefully getting out some more information on the next phase in the KBM once we get the hotfix with that.
Thank you, Jeannie. Great job. We do already have some questions rolling in, and I'll start reading those in a minute. And just a reminder, you can type your questions in the questions control panel of the GoToWebinar control panel. Okay, first question. That is, I'm looking at my NextGen root folder, and I do not see a components folder. Is it loaded when ICD-10 is loaded? Sean, do you want to take that one?
Sure. The components folder is going to be inside NextGen root, but once you open up NextGen root, you're going to have a prod, develop, test, demo folder, or if you have other environments, every environment is going to have its own folder. And when you go in there, it's going to be about the third folder down. You're going to have a components folder for every version of NextGen. It's where a lot of the pieces and parts are that go into the system. So it's not just with ICD-10. There's some other stuff in there. but if you go into the root folder, you have to go into the specific environment first, and then you can go into the components folder.
Okay, next question. Can we get a copy of the slides presentation? Yes, absolutely. Tomorrow we're going to be sending out an email to everybody who attended with links to download copies of the presentation, as well as a link that you can watch the recording of this webinar. So if you want to watch another part of it again or send it to somebody else, you'll be able to do any of that. And it's another way that you can get in touch with us as well if you have more questions. Next question. This one came close to the beginning of the presentation, and it says, what version of Excel works? 360 does not work for sure. Marie, you want to take that?
Yeah, so Microsoft 360 and Microsoft 365 are online versions of the Microsoft software, and they're typically a more limited version. So we recommend that you use an available application-based version, and that should work and solve any of those issues for you.
Anyone have anything to add to that one? Okay. We are currently preparing for 8.3.10 to be installed into test, so we can test prior to putting this into prod a couple weeks later, hopefully. After that, we will need to upgrade to 5.8 UD2. At what point in all of this should we do the hot fixes that are now available? Jeannie, you want to handle that one?
Yes, I can. If you're going to 8.3.10 and 5.8 UD2, you will want to wait and take the 5.8 UD2 most recent version and hotfix. If you want to do any testing on UD1, I'm assuming you're on UD1 now. If you want to do any testing on it now, I would just upload your ICD-10 codes, do some testing, but not worry about taking the hotfix on UD1 if you're actually going to be on UD2 before October 1st.
Okay, circling back to the Excel question, there was a follow-up on it. How do you get an application version of Excel? Sean, maybe you want to take that?
Trying to think. Well, it should, I mean, the first thing I would do definitely is ask some of the IT folks in your practice to see if you have the Microsoft Suite anywhere. That said, it may need to be purchased. That's one of the kinks that we've run into with a lot of folks trying to upload their ICD-10 is that they don't have Excel. So I would definitely start with the IT department, and then I would go, beyond that. Maybe they can find a way to get the application into at least your environments. You can run the utility from anywhere where you can see NextGen. So I would at least try to get it uploaded into one of those.
Thank you. Okay, next question. If you have created internal tracking codes in your diagnosis library, will these utilities override those codes? And to clarify, they are fake tracking codes. Sean, I think that was yours as well.
Sure. If there's anything in the library, whether it's ICD-9, ICD-10, or something that you've built custom, it will all still be available. So I would say if you have internal tracking codes that you're putting on chargers and that to do your own personal stuff, that I would just make sure that they're still available. You can set the expiration dates for ICD-9 and ICD-10 through the utility, and I would do that, but then I would go into the library and check up on your tracking codes to make sure that they're still available to use and they're not expired.
Thanks. Okay, next question. I didn't hear a mention of the claim edits 278 and 279. We have a question on those. If we enable 279 claim edit and then need to work on an encounter from post 10.1, how would this claim edit affect us?
That's a good question. Currently, right now, we have 9 and 10 both loaded. So we're not seeing that actually kick out, but I can test that one and get back with everybody on that. We need to just expire the 9s and then turn that on and see if it's going to cause problems with any claim edits of the previous claims. That's a very good question, and we can test it and see.
Okay, so we'll get you an answer on that one a little bit later. Next question. After we apply the hotfix, do we need to download the ICD-10 codes again in test and prod? If so, will NextGen be available to help us with this process?
You won't.
Jeannie,
You got that, Sean?
Oh, you got it. I was just going to say, you can correct me if I'm wrong, but it shouldn't have any data problems. All your codes should still be available after applying the hotfix. Is that
yes,
correct?
you're just going to have to run. Okay. Yes, you're just going to have to run the gem mapping again. You're not going to have to bring in the codes again or do anything with the actual code. You will just need to rerun the gem mapping after you do the hotfix.
Okay, next question. Is there any setup that needs to be done after loading the hotfix to make the Intercept tool work? Marie, you want to grab that one?
Yeah, I can. So there, okay, sorry. Can you repeat the question, Chelsea?
Yeah.
Actually, I can grab it. The Intercept tool, okay. There's just going to be an enable. I'm sorry about that. There's going to be an enable button, and you're just basically going to have to enable it once it's loaded. So there's no setup to it. It just will have an enable button once the Kbm hotfix is put in place and that is turned on. You will just have to click the enable button to get it to work. So if you're currently looking for that now, you are not going to find it.
Can you explain a little how we can, let me see, hang on a second. Let me read this in my head first. I apologize. Can you explain a little how we are to complete dual coding for ICD-9 codes dates prior to October 1st, 2015?
Can you ask them when they mean dual coding prior? Because there won't be dual coding. So any claims, and if I'm understanding the question, any visits, office visits, services prior to 10-1 will still allow you to use the 9 codes. And then the cutoff is 10-1, so date of service after 10-1 is going to use your 10 codes. So the way the system is set up, you will still have the 9 codes available for any date of services prior to 10-1. And then the new codes will be effective for date of services after. So you're not going to have to dual code those. They're actually just by date of service and how you're going to set that up to basically expire the one set and start the new one. Hopefully I answered that. If not, let me know.
Yep, you explained it perfectly. Thank you.
Okay.
Not for me. That was from the person who asked the question. Next question. We have 9s within our contracts. Can we go ahead and add the 10s to our contracts in prod before 10-1?
I'm going to say yes with that one, but again, I would like to test that one. I don't think it would affect anything as long as the 10s are not going into effect until 10-1. So I'm assuming you've already loaded ICD-10 into prod as well with a start date of 10-1 to do that. But I would like to test the contracts as well too, because I've not heard that there's any problems with this, but I'd like to run through the contract testing.
Okay, I'll flag that one to circle back to later after this webinar then. After we receive the PowerPoint from the webinar and have questions, who do we direct them to?
They can direct them to me.
Okay, that's Jeannie Logue. That's the second email address that you see on the screen there. Otherwise, if you just reply to the email directly back to the email that has all the links, Keith will make sure that it gets back to Jeannie as well. We're pretty good here about that. Follow-up question, will there be any webinars on how to use the Intercept tools that we can pass on to our providers?
We were just discussing this morning that we would like to do a phase 2 of this, so I think we're planning on trying to, once that comes out, doing a more KBM focused on the system practice templates and the Intercept tool and how all that's going to function once we get our hands on that hotfix in mid-July. So I would say yes, we are definitely going to try to come up with an additional webinar or some quick guides and handouts.
Okay, next question. Is the Intercept tool available in PM or only EHR?
Only EHR.
Oh, gosh.
Oh, go ahead, Marie.
No, that's what I was just going to say. It's designed to catch the code prior to the
Prior to going
PM
to EPM,
so.
yes.
Okay, and last question, unless you have any more. As a reminder, if you do have questions, type them in the control panel or else email any of these people that you see on the screen. So last question that I see at the moment. Are common assessments able to update prior to 10.1.15?
I'll go ahead and answer that. Absolutely. We're definitely recommending that clients, if that's part of the look ahead, that they start updating these now and as soon as possible.
Okay, great. Well, thank you everybody for joining us. Please follow us on social media, Facebook, Twitter, LinkedIn, YouTube. That's where we post all of our updates. We do tech tips every Tuesday. Most of them are NextGen oriented, and it's also where we announce upcoming webinars, and we're also going to be posting copies of the presentation there as well. So feel free to interact with us on social media. Anything else, Jeannie?
No, thank you very much for taking out of your busy time, and let me know if we can help, and hopefully this clarified a few questions out there on how to get started and get the testing going.
Thank you so much, guys. Have a great day.
All right, thank you, everybody.